Welcome back to County Connection. For this next segment, we're going to be talking about preventing opioid overdose deaths. And here to enlighten us is Public Health Director Amy Wineland. Welcome, Amy.
Thanks.
And we have Chief Mark Hemminghaus from Dillon Police Department. Welcome, Mark.
Thank you.
And Sheriff Jamie Fitzsimons. Welcome, Jamie.
Thank you.
All right, so Amy, we've been hearing a lot about opioids in the news lately. Can you give us a little perspective on the scale of this problem out there nationally as well as here in our community?
Sure. Well, Julie, as you've heard and many others across the nation have heard, we're really in a national epidemic. And it actually crosses all demographic characteristics. 4 out of 5 current heroin addicts begin their addiction by misusing and abusing prescription medications and painkillers. 29% of Coloradans admit to using prescription medications that was not prescribed to them. And actually here in Summit County, 10% of Summit high school students actually admit to using medicine prescriptions without a prescription that was prescribed to them. Since 2000, the overdose deaths in the nation have quadrupled.
Wow.
And
wasn't it just recently that, that overdose deaths exceeded motor vehicle deaths for the first time?
That is accurate, that Americans are dying faster by overdose deaths and more than motor vehicle accidents. That's true. In 2016, across the nation, there are just under 55,000 deaths a year.
Wow.
And that's about 135 per day.
Wow.
That are dying, Americans that are dying from overdoses. In Colorado, per year, we have nearly 500 opioid-related overdose deaths, and Summit County is the 11th highest for overdose deaths in the state.
And is that on a per capita basis or just a straight number?
It's per capita.
Okay. So it, as you say, it has reached epidemic levels, and so here in our community, many organizations are working on this problem in some manner or another, and it's really a spectrum of strategies. So what is going on locally? Yeah,
sure. We are engaged in several different strategies to combat the issue, prevention strategies, and they do include multi-agency collaborations. One of those is that we're providing training for prescribers and providers in the community around the new CDC guidelines around opioid prescribing. We do a lot of drug abuse education and safe storage education, as well as promote our drug take-back program, which has been a huge success.
Right, and the chief and the sheriff have been really leading the charge in that regard.
That's right.
In the take-back issue. Can you guys talk a little bit about just how that's been going so far?
Drug take-back's been going great. So we have now locations. We've had one at the sheriff's office for some time now. It's the one available in the county 24/7, 365. It's always available. Chief Hemminghaus has one at Dillon PD, Dillon Town Hall. It's available during business hours.
Correct.
And there's one in Frisco at Prescription Alternatives that's available during their business hours.
Great. And so this strategy really speaks to getting those unused medications out of medicine cabinets where they're accessible for people that shouldn't be using them or it's not prescribed to them.
That's right, because most folks who do misuse and abuse them actually get them from friends or family members.
Okay.
So it is important to get those out of the house and or store them safely in a locked cabinet.
Great.
And
that brings us then to the strategy that we're really going to focus on today.
Yeah, our new strategy is actually arming our law enforcement officers with Naloxone. Yeah.
And so what is Naloxone?
So for me, it's the easiest way to describe it is that it's an EpiPen for opioids.
Okay.
So opioid deaths occur, cause death by slowing respirations and eventually stopping respirations. So Naloxone, or Narcan is the brand name, is something that can reverse the effects of the opioid and actually resume respirations within 2 to 5 minutes if it's administered in a timely fashion. It's a really great drug because it is very safe to use, even if whoever receives the medication isn't actually being affected by opioids. It does not cause any harm.
Okay.
It's most important to know, though, that you still do need medical care after it's been administered. It is only going to allow a certain amount of time before those opioids will take over again and cause respiratory distress. So anybody who gets it does need to be transported to the hospital for treatment.
So it provides some temporary protection from those effects.
Exactly.
Okay.
And it's really important to mention that it's not a cure. It's not a cure for addiction. But treatment options are really hard to get into. There are long wait lists, and here in Colorado, if someone wanted treatment today, they would have to wait days to weeks before they could enter rehabilitation. So naloxone saves lives until someone is ready and willing and able to enter into treatment.
Okay. So let's talk about the role of law enforcement in this strategy. What are the various law enforcement agencies in Summit County doing in terms of utilizing naloxone or Narcan?
So one thing we learned years ago when we started deploying AEDs in our vehicles is that often law enforcement is the first emergency responder on scene of various types of incidents, and medicals included. And so back in May, Joint Chiefs and myself partnered with Public Health and St. Anthony's Medical Center and talked about how to obtain Narcan for law enforcement and how to get us trained and deployed. And so we got trained and deployed as early as June, and the sheriff's office has already had one save.
Great. So how does this, on an operational level, how is this deployed in the field?
Well, first of all, the training was very easy, provided by St. Anthony's. It was great. And thank you and the health department for purchasing it. It made it super easy. So all the officers at our department went through training, and then we were issued the naloxone. And I personally carry it, right here where it's easily obtained, and I can go on scene and go to work with it. Every officer carries it in a different position, just based on how they have their gear set up and where it can be carried comfortably and without destroying it. So it's really been a very easy process.
Great. And so then every law enforcement officer in Summit County now carries this on them?
Every law
I
enforcement
believe
officer.
so, yeah.
Okay, great. And so there, in addition to law enforcement officers being first on scene to a potential overdose, there are some other reasons why this is a good strategy for law enforcement. Can you talk about that a little bit?
Well, we get on scene, and like you said, a lot of times we're the first ones on scene, and for protection for the other medical personnel that arrive, it's good for us to be there. I do believe that I've never seen it. I don't know if you have the story that people come out of the high somewhat violently sometimes.
Okay.
So that was part of the training as well. To be aware that they might come out and not be happy, be a little upset that their high was ruined by this, because it does. So there's that. There's the factor of other people on scene that may not be happy to have us there, thinking they're calling medical, and we pretty much show up on all medical calls that, as long as we're available, we're there. So we're there for scene security as well, scene safety.
Okay.
It's also a way to protect the officers. There are a lot of synthetic heroins out there and other medications like fentanyl that can actually cause the responder to have an overdose. And so it's also a way to be able to administer it to those who are responding to the scene.
Gotcha. And so we've been focusing on law enforcement, but the reality is anyone can use this. And so for civilians, how would they go about doing this, Amy?
Right, so it's been really great that our state has passed some laws. And in 2015, the state legislature passed a law for standing orders for naloxone to participating pharmacies. And what this means is that anybody can go into a participating pharmacy and purchase naloxone. It comes in a couple different forms. It's injectable, or it can be an intranasal spray. And so the thought behind that, and they don't need a prescription. They can go in and ask for it and purchase it.
Okay.
And really what ideally users, friends, family members should have this on hand in case of an emergency. That's the idea behind this law, so that it's easily accessible for those who need it most. And here in Summit County, our participating pharmacies include City Market at Dillon and Breckenridge, Safeway, Target, and Walgreens. All carry it.
Okay. And then is there a way for, again, friends and family members of users to get training so that they're using it properly, or to get the information they need in order to be able to administer it?
Yes. Well, certainly the pharmacist can help with that education. And then they can always call Summit County Public Health, and we can steer them in the right direction for some proper guidance.
Okay, great. All right. Is there anything that you would want to add about the topic, Amy?
No, I'm really excited for the collaborative work that we have going on in the county. There's a lot of momentum and passion around this subject, so that we can continue to improve and add resources to our community around preventing these deaths.
All right, great. And then if folks want to get in touch with you about this topic at Public Health, how can they do that?
They can call 970-668-9161.
Great. And then we have information about all of our agencies that are working together on the drug take-back as well. And that's on the Summit County website at summitcountyco.gov/takemedsback. And you can find out all information about the locations of our take-back boxes. Great. Stick with us. We're going to take a quick break. And when we come back, we're going to be talking about a new interactive tool launched by the Open Space and Trails Department.